Did you know that a woman's menstrual cycle holds the key to both preventing and achieving pregnancy? In this video, we'll explore the fascinating world of menstruation, uncovering the secrets behind using the menstrual cycle as a natural contraceptive method, as well as maximizing the chances of conception. Get ready to unlock the power of your menstrual cycle and discover how it can shape your reproductive journey. Welcome to Meducatives. This is the official YouTube channel of www.meducatives.com. We believe that awareness is everything and our goal is to promote it. Menstruation, also known as a period, is a natural part of the menstrual cycle in women. The menstrual cycle is a complex hormonal process that prepares the body for pregnancy. It typically occurs once a month, although the exact timing and duration can vary from woman to woman. The menstrual cycle is controlled by various hormones, primarily estrogen and progesterone. At the start of the cycle, the levels of these hormones are low. As the cycle progresses, the ovaries start producing increasing amounts of estrogen, which stimulates the thickening of the uterine lining, known as the endometrium. The endometrium prepares the uterus to support a fertilized egg. The menstrual cycle is the interval between the first day of one menstrual period to the first day of the next. The average cycle is around 28 days, but it can vary among women. Factors like hormones, stress, lifestyle, health conditions, and age can influence cycle length. The cycle consists of 3 phases: follicular phase, from menstruation to ovulation, release of an egg, and luteal phase, from ovulation to next period. Ovulation usually occurs around day 14 in a 28-day cycle. The luteal phase lasts about 14 days and prepares the uterus for potential implantation. If fertilization doesn't occur, hormone levels drop, leading to the shedding of the uterine lining and the start of a new cycle. Menstrual cycles can range from approximately 21 to 35 days, and various factors can contribute to cycle variations. Menstruation and ovulation are distinct processes in the menstrual cycle. Menstruation refers to the shedding of the uterine lining, marking the start of a new cycle. It involves the discharge of blood and tissue from the uterus through the cervix and vagina. Ovulation, on the other hand, is the release of a mature egg from the ovary. It occurs around the middle of the cycle and is essential for fertility. Ovulation is triggered by a surge in luteinizing hormone, LH, and typically lasts for 12 to 24 hours. The timing of ovulation varies among women and cycles. If fertilization occurs, the egg implants in the uterus, resulting in pregnancy. If not, hormone levels drop, leading to menstruation. The amount of blood lost during menstruation can vary among women, but on average, it is relatively small. It is estimated that women typically lose about 30 to 40 milliliters of blood during a menstrual period. To provide a visual reference, this amount is equivalent to approximately 2 to 3 tablespoons. It's important to note that the menstrual flow is not purely composed of blood. Menstrual fluid consists of a combination of blood, tissue from the uterine lining, vaginal secretions, and cervical mucus. This mixture gives the menstrual flow its characteristic appearance and consistency. The color and consistency of menstrual blood can vary. It can range from bright red to dark brown, and the flow can be light, moderate, or heavy. Some women experience premenstrual syndrome, PMS symptoms. Physical symptoms include bloating, breast tenderness, cramps, fatigue, headaches, and changes in appetite. Emotional symptoms include mood swings, irritability, anxiety, depression, increased sensitivity, and changes in libido. Behavioral symptoms can include sleep pattern changes, difficulty concentrating, appetite changes, and feeling out of sorts. The exact cause of PMS is linked to hormonal changes during the menstrual cycle, including fluctuations in estrogen, progesterone, and brain chemicals like serotonin. Severe symptoms may indicate PMDD and require medical attention. Managing PMS involves exercise, a balanced diet, stress management, and medications like pain relievers or hormonal birth control. Consult a healthcare professional for severe or disruptive symptoms. Menstrual cramps, or dysmenorrhea, are caused by the uterus contracting to shed its lining during menstruation. Higher levels of prostaglandins trigger these contractions, resulting in cramps. There are two types of cramps: primary dysmenorrhea without an underlying condition, and secondary dysmenorrhea associated with conditions like endometriosis. Symptoms can vary in intensity and duration, including lower abdominal and back pain. Management strategies include over-the-counter pain relievers, NSAIDs, heat therapy, exercise, relaxation techniques, and dietary changes. If severe or disruptive, it's advisable to consult a healthcare professional for evaluation and additional treatment options. Various factors can disrupt regular menstruation and lead to irregular periods. These include stress, diet and exercise, hormonal imbalances, medical conditions, contraception and medications, perimenopause and menopause, and other factors like travel, weight fluctuations, breastfeeding, and certain medical treatments. It's important to be aware of changes in menstrual patterns and irregular periods, as they may indicate an underlying health issue. Consulting with a healthcare professional is recommended for evaluation, necessary tests, and appropriate diagnosis and treatment options. Menstrual hygiene is important to prevent infections and maintain overall health. Using sanitary pads, tampons, menstrual cups, or other menstrual products and changing them regularly is crucial. Additionally, practicing good hygiene, such as washing hands before and after changing menstrual products, is essential. The power of your menstrual cycle: understanding fertility and natural birth control. The best time to have intercourse for pregnancy is during the woman's fertile window, which is the time when she is most likely to conceive. The fertile window includes the days leading up to and including ovulation. Ovulation typically occurs around the middle of the menstrual cycle, but it can vary among women. Suppose a woman has a regular menstrual cycle of 28 days, with her period occurring on July 2nd. To determine the potential fertile window and the best time for intercourse to maximize the chances of pregnancy, we can follow these steps. Calculate the average length of the menstrual cycle. Subtract the start date of the previous period from the start date of the next period. In this case, if the woman's cycle is consistently 28 days long, her next period is expected to start around July 30th. Identify the potential fertile window. The fertile window typically includes the days leading up to and including ovulation. For a woman with a 28-day cycle, ovulation often occurs around day 14. To calculate the estimated ovulation day, subtract 14 days from the expected start date of the next period. In this case, July 30th minus 14 days gives us July 16th. Determine the range of the fertile window. The fertile window is not limited to a single day but is a range of several days before and after ovulation. In general, the fertile window spans approximately 5 to 6 days, including the day of ovulation and the days leading up to it. In this case, the fertile window is estimated to be from around July 12th to July 17th. Find the best time for intercourse. To maximize the chances of pregnancy, it is recommended to have regular intercourse throughout the fertile window, especially in the days leading up to ovulation. In this example, having intercourse on July 12th to 17th would cover the key days within the estimated fertile window. A natural contraceptive method involves avoiding intercourse on specific days to prevent conception. To utilize this method, it is recommended to abstain from sexual intercourse on July 12th and 17th to minimize the chances of conception. In conclusion, understanding the menstrual cycle empowers individuals to make informed choices about their reproductive health. By tracking and recognizing the different phases of the cycle, individuals can optimize their chances of conception or effectively use natural methods for contraception. This knowledge promotes greater control and decision-making when it comes to family planning and overall well-being. Thanks for watching. Please visit our website www.meducatives.com. You may like our free ebooks and medical and health educational products on our website. If you enjoyed the video, please consider subscribing, sharing, liking, commenting, and pressing the bell icon to receive notifications for more content like this. Lastly, don't forget to follow us on Instagram, Facebook, and Twitter.